Hi, very good evening to all of you. Today we are going to see this particular case. The patient name is Florence Arthur, and the writing task is to write a transfer letter to Miss Nadia Schroeder, who is the head nurse of the urology department, explaining the condition of the patient in detail and highlighting the need for bilateral nephrostomy tube insertion. So this is the the condition, and this is a letter that you are going to write. You are going to write a transfer letter to Miss Nadia Schroeder. So let's go in detail what exactly happened to this particular client. Who are you? First of all, you are Kate Andrews. Kate Andrews is treating a 28-year-old female client. Her name is Florence Arthur. Now she is admitted to the emergency department complaining of pain across her back. So this is the thing here. Now let us see the patient name is Florence Arthur. Date of birth 92, that's 28 years old. It's given, you can write either this thing or that thing. Stones were there in 2002, that's around 18 years ago. Now 3 months ago there was an uncomplicated episode of cystitis, that's also a problem there 3 months ago. Now right now what has happened, she became unwell 2 days previously when she started to develop a fever on a backache is there. At the same time, fever is there, vomiting is there, and the pain has become more severe, was worsening. So now we have assessed the condition and we started empirical antibiotics and analgesics. Blood investigations were ordered. The reports came. Before that, we have to see the vitals abnormal. You have increased temperature, pulse, and a little bit lower BP there. You have tenderness in the abdomen. You have that is marked in both loins. And you have the abnormal investigations detailed there, but it is summarized there towards the down. You can say that ultrasound bilateral hydronephrosis, blood investigations shows elevated C-reactive protein and white blood cell count. Now, urine analysis showed a microscopic hematuria and leukocytes in the urine because of the inflammation of the urinary tract. So this is a condition where you need to go for a urinary intervention from the urology department. So that's a specialized thing here. It's not done in the emergency department. You have to transfer the client to the urology department right now. And you need to highlight the need of bilateral nephrostomy. You know that this fluid pressure is high and this is to be relieved. This is what we need to see in this particular letter. And now when we go ahead with the plan, you are planning to transfer the patient to the urology department. You have further plans to go with the culture, blood and urine culture, and you have to go with the intravenous antibiotics and fluids unless and until this particular organism is identified. This should continue. So once this is identified, the organism is identified and the treatment is going on. Later, it can be switched to oral antibiotics. This is what you can say. Now, the initial first line treatment, you can go with the gentamicin and ampicillin or ciprofloxacin. This is what the options we are given. We have there. Now, let us see the date today is 15 September 2020. Miss Nadia Schroeder, head nurse, urology department. Dear Miss Schroeder, reference Florence Arthur, aged 28. Let us go ahead with that. The purpose. This is the purpose. The purpose of this letter is to transfer Miss Florence Arthur, who requires the insertion of bilateral nephrostomy tubes at your department. She has been diagnosed with hydronephrosis and urinary sepsis. That's it. We don't need anything further there. So now what's presenting compliance? So before we go with the presenting complaints, let's look at the purpose another time. The purpose of this letter is to transfer. The purpose is to transfer the patient name, full name, Mrs. Florence Arthur. What she requires insertion of bilateral nephrostomy tubes at your department. She has been diagnosed. What's the diagnosis? Diagnosis: hydronephrosis and urinary sepsis. This is what this thing is. Mrs. Arthur presented to our care yesterday, was admitted to our care. Now she was not presented, was admitted. Our care yesterday with complaints of fever, with complaints of progressing lower back pain, along with fever and vomiting. So she came yesterday with complaints of progressing lower back pain across along with fever and vomiting. After initial assessment, she was treated conservatively with antibiotics and analgesics. Subsequently, she underwent a series of blood investigations focusing on her renal function. Okay, done. Now, what happened here? Now, today, Miss Arthur appeared flushed, and her vitals, it's not his vitals, her vitals were not recorded within the normal range. Examination revealed tenderness on her abdomen, most markedly in the loins. Her blood investigation results showed elevated the white cells count and CRP, which indicated bacterial sepsis. Her urinalysis report indicated inflammation in the urinary tract, and ultrasound confirmed bilateral hydronephrosis. So this is the present condition. So what I need to do, In view of the above, what is there above? What is there above? You have tender abdomen, elevated WBC, CRP, bilateral hydronephrosis. In view of the above, it would be appreciated if you could accept Mrs. Arthur to your care, since she needs the insertion of bilateral nephrostomy tube to ease her back pressure and relieve her discomfort. Now I will be moving ahead with a small editing there. In view of the above, it would be appreciated if you could accept Mrs. Arthur into your care, since she need that's enough. Since she needs the insertion of bilateral nephrostomy tubes to ease her back pressure and relieve her discomfort. Kindly commence intravenous fluid as well as antibiotic therapy with gentamicin and ampicillin until the organism is identified in the culture results. Oral antibiotics, which are sensitive to the organism, can be started following this. Yes, after this, you can do that. Now, if you have any further queries regarding all those conditions, please do not hesitate to contact me. You are sincerely Kate Andrews, Emergency Department Nurse. Now we have 3 paragraph stuff after the purpose. The first paragraph is the way Mrs. Arthur was admitted. What were the complaints and what you have done as the treatment. Today, what's her condition in detail? It's clear. Next, what you have to do, it would be appreciated. In view of the above, it would be appreciated if you could accept Mrs. Arthur, because she needs the insertion of bilateral nephrostomy tube to ease her back pressure and relieve her discomfort. This is what we are going to do there. And we need to go ahead with the IV fluids, antibiotic IV, until the organism is identified in the blood result, blood culture and urine culture. Okay. Okay, now oral antibiotics which are sensitive to the organism can be started following this. After that, after this thing, we can just stop the fluids and IV antibiotic therapy and switch it to oral antibiotics, which is sensitive to the organism. If you have any further queries regarding Mrs. Arthur's condition, please do not hesitate to contact me. So I think this thing is very clear from the very beginning. Today's date, and the person who you are writing the letter, her position, department, salutation, reference, and the age, the purpose. In the purpose, the patient name, the purpose is transfer. Why are transferring? For the insertion of a bilateral nephrostomy tubes. What is the condition? It is clear. How she came, it was there in the first sentence, first paragraph. And what is her condition today is there in the second paragraph. And what you have to do is there in the third paragraph. Thank you.